So the first one, I'm going to show you the humero-ulnar distraction. The elbow is at 70 degrees of flexion, 10 degrees of supination. I am pulling at a 45-degree angle to the ulna, so I am pulling straight toward me. This is the angle of the bone, but I always need to pull 45 degrees from that angle. I'll rest his wrist or distal forearm on my shoulder, grab the ulna with one hand, and then bring your hand over with the other hand, and I just pull straight toward me like this. If I feel like I'm taking his shoulder with me, I can use weight. Okay. The inferior glide of the ulna is used to increase elbow flexion. Okay. And what I do here is the same technique. I will do my traction, but then if I need to glide the ulna inferiorly, which way do I have to glide it? Along the shaft of the bone itself. So what I'll do is I'm going to get in here again. Now I have to use a little more force. So I kind of get low, get into kind of a squat position, same hand placement as before. I'm going to distract, and then I'm going to scoop, basically trying to pull his ulna in an inferior manner. Okay. Out. Okay. So we're going to do a dorsal glide of the radius in order to improve supination. And so I want to hold his ulna with one hand, get onto the radius with the other hand. My mobilizing arm is going to be a straight arm. So elbow is straight. He needs to be in 70 degrees of flexion, so come up a little bit more, and 10 degrees of supination. And what I'm doing is this is my technique. Just like that. Okay? So I don't let the ulna move, I just make the radius move. Okay? No. So now I'm going to mobilize the proximal radial ulnar joint. And when I'm mobilizing the proximal radial ulnar joint, we're dealing with a convex surface moving on a concave surface. Okay? So if I want to increase supination, then I want to do a volar glide. It's counterintuitive to what the direction of movement is. So again, I'm going to stabilize his ulna. He's in about 35 degrees of supination here. Grab onto the radius, okay, and I'm gliding this way. You can feel that. I'm sure you can feel that.
He can hold his hand with the other
hand. And you can come over like this and hold, there we go. So that's the technique. Again,
do a distraction of the radiocarpal joint, okay? So again, we said the radius is concave, and you guys can come around, the proximal row of carpals is convex. So if I'm going to do a distraction, again, my treatment plane's here, and I'm going to pull straight out from that for distraction. Now, what you want to do is stabilize the radius, okay? But you want to tense his skin a little bit, so add a little pucker in there, because then when I pull, okay, I got to let that skin kind of go with me. You feel that? Feel that, huh? And then I let it go. Okay? If I don't tense his skin, see if this doesn't feel quite so good.
I feel like it needs some motion.
If I'm going to do a volar glide, what will this increase? What motion will this increase? Extension. Okay? Because it's opposite. All right? So, what I will do again is I get right on and I stabilize the radius. Obviously, I'm on the ulnar as well. I get right on that proximal row of carpals. I keep my elbow straight, and I basically put my force right down to the ground, okay? Again, tense the skin slightly, and come straight down. Remember, with any glide, you are doing a slight traction. So do a slight traction or distraction, and then I come down. I'm now going to do a dorsal glide. Okay, and if I'm doing a dorsal glide, which is basically coming up this way, what motion am I trying to correct? Flexion. Okay, so again, hold on. I have him in the resting position, which is neutral. I hold on to his radius. I tense his skin slightly, and I pull up. And you're not going to see much on that video, but I pull up towards me, or up towards the ceiling. So, again, in order to do a ulnar glide, okay, to correct radial deviation, okay, I keep his arm so that it's midway between supination and pronation. I hold on to his radius, I come down, and I got his first row of proximal carpal bones, and I come straight down towards the floor. Felt that. Again, I'm proceeding all of these with a slight traction, very slight. Okay? So that is to correct radial deviation. We are now going to show a radial glide. Okay, so if I do a radial glide, again, basically what I'm going to do is grab onto his proximal row of carpals and pull up. Okay, this is one of those I have to pull. Okay, so I stabilize his radius. Okay, I come right around his proximal row of carpals, and I go up towards the ceiling. Again, my mobilizing arm is staying relatively straight. And a radial glide is to correct what motion?
Deviation.
Very good. Can you show us? Thank you.
Let's pan in on Kelvin here. Say hi, Kelvin.
Say hi, Kelvin. Show this first, and then I'm going to get one thumb right on the edge of the clavicle, right on the superior component of it. That is kind of my dummy thumb. My other thumb comes right over that, okay, and I press inferiorly. So right towards my finger, in the direction my fingers are, and back up. I come here and do that. Okay? I am right on the superior border of the clavicle, as close to the joint or the sternum as possible. I have a dummy thumb, okay, that's right on the superior aspect of the clavicle. My mobilizing thumb comes over that, and my force is inferiorly and back. Okay? I have a problem with retraction. Okay? The shape of my clavicle changes here, and it is actually concave, moving on a convex sternum. Okay? Therefore, I again put one thumb here, right on basically the anterior border of the clavicle. That's my dummy thumb. I put my other thumb over that, and I push straight down in a posterior direction. You can actually feel that pretty good. Does that make sense? It almost looks like I'm strangling.